request now I request Saraswati, tutor of microbiology.
Today I am going to present about HIV-0 positivity among known TB positive cases and sputum smear positivity among known HIV positive individuals and a comparative study of both G. Wilson state and Orman-O state. Introduction. Global annual incidence of tuberculosis is 9.23 million. India annual incidence of tuberculosis is 1.9 million according to WHO report 2009. Annually 1.9 million new tuberculosis cases were reported. Out of 1.9 million people are affected in our country, more than 35 lakh people are sputum smear positive and highly infectious. Tuberculosis cases reported more in North India and compared to South India, and incidence is more in urban areas and more common among males. Out of 40% of infected persons, only 10% of people will develop tuberculosis in their lifetime. Co-infection with HIV increases the risk of developing tuberculosis by 5 to 6 times. Other factors which increases the risk of tuberculosis are smoking, poor nutrition and diabetes. Out of 2.4 million people are living with HIV infection, 1 billion people are co-infected with tuberculosis. Other way, this incidence of HIV and tuberculosis is varies between states from 1% to 14%. 5% of tuberculosis patients were estimated to be HIV positive. As per WHO Global Tuberculosis 2009, India is the country showing more incidence of multiple drug-resistant cases, which have been reported as 131,000 cases emerging annually. Present work is taken up to know the incidence of HIV infection in non-tuberculosis cases and to know the sputum smear positive cases of tuberculosis in non-HIV positive individuals. As the incidence of both the diseases are common in association. In addition, a comparative study of sputum smear positivity by two different staining methods. One is usual gene lesson staining technique and other one is direct fluorescence staining technique by Orman-O. Study group 500 patients suffering from cough and fever for more than 2 weeks attending at DMC Mims. 500 patients attending ICTC at Mims for a period of 1 year. Specimen collection. 2 consecutive sputum samples from spot and on early morning were collected from individuals attending DMC and HIV-0 positive individuals from ICTC. 5 ml of venous blood was collected from each individual attending ICTC and from those who were AFB positive in DMC after taking written consent from them. Both the samples were processed on the same day of collection. Processing of sputum samples. Smears were prepared from all the specimens collected and stained with G. Wilson stain. 50 sputum smears were selected randomly and stained by Orman-O. Processing of blood samples. Serum was separated and subjected to HIV antibody testing by using different ELISA kits as per NACO guidelines. So this is the slide showing acid fast bacilli by G. Wilson staining. This is the acid fast bacilli and this is the fluorescent microscope which is present in our department. And these are the happy green color acid fast bacilli stained by Orman-O. Coming to the reports, out of 500 samples screened for tuberculosis, only 76 smears were positive. The percentage is 15.2%, and out of 76 sputum smear positive cases, only 4 cases are reported, that is 5.3%. The age incidence is more between the age group 46 to 55 in case of sputum smear positive samples and 36 to 45 in case of HIV-0 positive samples. So, out of 500 blood samples screened for HIV, only 81 samples are positive for HIV. Percentage is 16.2%. Out of 81 HIV-0 positive samples, 2 cases are reported as sputum smear positive cases. The percentage is 2.5%. The age incidence is more between the age group 26 to 35 in case of HIV-0 positive samples and age incidence is more between the age groups 26 to 45 in case of sputum smear positive cases. And 50 sputum samples selected randomly and stained with G. Wilson and Orman-O stain. 32 smears shows G. Wilson stain positive and 34 smears shows Orman-O stain positive. bodies, 81 were found to be HIV zero positive. Out of 81, 2 were positive for vaccinate by gene strain, that is 2.85%. HIV zero positivity in tuberculosis cases were more in our study when compared to sputum smear positivity in known HIV zero positive cases. This low incidence may be due to extrapulmonary exclusion of extrapulmonary tuberculosis in the present study. Out of 50 sputum smears which are selected randomly, 32 were positive by gene strain and 34 were positive by RMNO. So AO strain was found to be more useful when compared to gene strain. Thank you. Sputum positive.
Randomly out of that?
Randomly selected for AO strain and gene strain. I done for both the staining methods.
అట్లాగా వీడియో అవుతుంది అందరూ తీసుకుంటారు
At outside, the organization was permitted to present a rare case of mucosal of the abdomen. The first case reported in Mims Medical College Hospital. In my life of 4 decades in surgery practice, I have seen about 10 cases like this. Preoperative suspicion and diagnosis, preoperative diagnosis and type of approach, either laparoscopy or open surgery, return this problem. Hello. The incidence is about 0.2 to 4% of all appendectomy cases. We know a patient of 55-year-old by name Viziangaram was admitted on 19th December. Of 3 days duration. On clinical examination, there are tenderness in the right iliac fossa. We investigated them. Otherwise, she appears to be normal. And investigation, the relative leukocytosis, plain X-ray abdomen is normal. Ultrasound showed elongated tubular lesion at 9.4 centimeters, an echogenic mass in right iliac fossa. Next slide, please. We have done an open surgery because laparoscopy will cause disseminative disease or any injury to the mucosa will produce a dissemination. In these cases, there is no evidence of ganglion, abscess or fluid and no malignancy. The cut section it was shown like this. Next slide. It shows the mucosal glands lined by columnar epithelium and everything appears to be mucus distended segment. Okay, ma'am. And it was reported by Rokitansky in 1846. Next, this is a common presentation. Why? Because around one case was reported with about 50 lakhs of patients, 60 lakhs of these cases. Next slide, please. For discussion, this being incidentally happened. A pre-operative diagnosis is very essential. A distended mass in the right iliac fossa, you always suspect the first possibility may turn into sometime a malignancy. Once the histopathology shows a malignant variety here, you have to go with the right hemicolectomy. That is the part of about 10 centimeters of the ileum, cecum, ascending colon and proximal 1/3 of the transverse colon. Ileal ascending coloscopy is done in these cases. Next slide, please. This is known to produce some inside factors like P-colis, and we have benign epithelial neoplasms. We should always think a possibility of differential diagnosis: leiomyoma, fibroma, neuroma, and lymphoma. The mesenteric duplicate cysts are seen in this area, and you have a classical picture of mesenteric cysts. They are perpendicularly moving about the thing which is attached to the mesentery. Next slide. The computer tomography show. This is a classical sign where a volcano sign, a mound-like appearance where the esophageal orifice will present. CT shows the encapsulated cystic mass in right iliac fossa. Next slide. the endoscopic side, where appearance of this looks like a volcano. That's what volcano side. Next slide. Always a surgical resection. The right hip collector, I already mentioned it. The ruptured mucosal, the lesion should be excised and all mucinous present in the peritoneal cavity should be removed and peritoneal wash should be given and we should go with the same. In conclusion, the whole taking message will be, it's a rare individual, but you should think it's a possibility. In general, we will tell the young individual when there is a distended mass in radial fossa, when you are comparing a ovarian cyst, this is the first possibility. Wherever you are, whether Mims or outside, wherever you practice, the first possibility is because you are the appendix. Thank you very much for the kind hearing. Thanks. Thanks for the projection. She is my teacher. Okay, any queries?
Sir, I would like to ask you,
Madam.
sir.
Madam, don't pass up, madam. I am your student, madam.
Recently we had one case sent from gynae department.
Yes.
Yeah, I don't know, is it the same case or?
No, that's different, madam. That's pseudomyxoma peritoneum. I was involved. Madam, myself has done it.
Because
Panda, madam, myself have done it. That case, that is different. It's pseudomyxoma peritoneum, madam. We have 3 cases. She is waiting for the review, madam. Follow for 2 years is necessary for that case. We are waiting to publish that case. We are with them. We have seen, my daughter also published a case similar thing. I have seen about 10 cases in the last 4 decades of my life in surgical practice. So it's a very rare condition. But you should think when there is a right leg of massa, automatically you are doing an ultrasound examination. A cystic mass at that reason, most of the times you see in a female individual, commonly in females. Once and for, this is a common condition. In that way. Thank you very much for kind hearing, madam.
Thank you, sir. Now I request Dr. Ramesh, madam, to give certificate of participation to Dr. Kamala.
I remember Shyam very well, clinical pathology posting in
To the dais and present talk on clinical profile of orbital disease. My topic is clinical profile of orbital diseases. Side-lifting but also light-lifting and spectrum of orbital diseases is varied. Etiology is multifactorial including cystic diseases, infections, inflammations, parasitic infestations, neoplasias, primary and secondary trauma, congenital lesions. Aims and objectives of my study is to study the various diseases affecting the orbit, the modes of management and the outcomes during the study period, and to determine etiology, pathogenesis of diseases, various modes of management and final outcome of treatment. And patients and methods included the patients attending outpatient department of ophthalmology, Mims General Hospital, Viziangaram. It is a prospective interventional case series with number of patients in the study is 75 and the study period is from February 2013 to June 2014. And the criteria included all the new cases presenting with orbital diseases including trauma and followed up for a minimum period of 3 months. Excluded the patients who have already undergone treatment elsewhere and who are not willing to undergo treatment or lost to follow-up. And investigations included detailed clinical examination, blood investigations, radiological imaging, cytology and immunological. And management options included medical, especially in myocystic sarcosis, orbital cellulitis, non-specific orbital inflammation, thyroid-associated orbitopathy. And surgical options are biopsy, debunking, total excision of the lesion. And the results of my study. It is a table showing agent sex distribution with most common age group is between 21 to 30 years. It is a pie chart showing the sex distribution with most common in the males in 50 cases and in the females 25 cases. Distribution by diagnosis, most common causes trauma followed by thyroid-associated orbitopathy followed by adenoids, cavernous hemangioma, etc. It is the bar showing distribution by diagnosis, etiological distribution, comparison between pediatric age group and the causes. And it is a marker showing etiological distribution. And etiological distribution with most common causes trauma followed by systemic followed by neoplasias. These are the pictures showing the different causes of orbital diseases, trauma, thyroid associated orbitalopathy, etc. And duration of presentation, majority of cases present with chronic onset in 52 cases and subacute in 15 cases and acute in 8 cases. Modes of presentation, the most common mode is prominence of the eyes in 62% followed by defective vision, pain, diplopia and swelling. And most common is eccentric proptosis and unilateral is the most common type. These are the various types, unilateral, bilateral proptosis. And the signs, restricted ocular motility is most common in the 50 cases. Proptosis in 47, lid retraction 60 followed by lag of thermos, synophthalmos, exposure, keratopathy. These are the various signs listed. And management options followed are medical and surgical. 7 cases were referred for further evaluation and management. Visual outcome and improvement in other signs have been managed.